Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, I have the founder and CEO of Interface Health with me, Michael Bedeau. Welcome to the show, Michael.
Thanks very much, Roxy. Much appreciated.
So let's just kick off the conversation by telling our listeners a little bit about your background and what you do.
So, my name is Michael Bedeau, as you just said a minute ago. I am the founder and CEO of Interface Health Society, which is a not-for-profit organization based in Vancouver, Canada. The accelerator that I'm running is focused on 100% on digital health technologies. Our model is a virtual model where, startups and SMEs can join anytime. We don't have a cohort model like many traditional models out there. And so we started creating this kind of model in 2015. In a way, we maybe figured that one day the whole world would go virtual as a model. And so we're quite early adopters that way. And so we have been very successful. We created a global network of innovators. We started with 50 members or so. We ended up with about 5,300 individual members, about 1,200 companies, big and small, of which about 750 startups and SMEs from about 20 different countries. Our model is a partnership with digital health accelerators around the world. So we have relationships with about 30 of them from Canada, US, UK, Germany, Romania, Chile, Brazil, Israel, South Korea, Australia, New Zealand, and so on and so forth. Mm-hmm. So that's kind of what the organization that we set up. And we do a couple of things at Interface Health. One is we have a Digital Health Innovators Network, similar to a LinkedIn, if you like, where we connect startups and entrepreneurs with the resources they need. Could be services, could be talent, could be money, could be simply opportunities to ideas or sharing ideas about what's new and what's coming in the market. That's one thing. Secondly, we did a global competition to find the best innovators in the world. And that's how we ended up working with digital health accelerators from around the world. And that model is almost like considered the Olympics of digital health innovation, if you like. Yeah. And so that gave us a very good view of about 200 of the best innovators in the world. We've done that in 2015, 16, and 17. And, the top 10 end up at our conference. We have an annual conference called Interface Summit in Vancouver. And so the top 10 get invited where we have them here for 2 days, meeting with innovators, with healthcare systems buyers, with kind of the demand side of the innovation ecosystem. Mm-hmm. And those are companies from all over the world. It's a tremendous event. And then, so that's the network, the global competition, the annual summit. And in addition to that, we created a showcase called Interface Showcase, where startups can actually show some of their new products and services. And you can look at interfaceshowcase.com. So that's about the company I'm running. My background is I'm an entrepreneur. I started about 9 companies. As a matter of fact, right now I'm in the middle of launching my new startup called Mind Therapeutics. So we're focusing on digital therapeutics, particularly in the obesity and weight management for women. Mm-hmm. And so that also gives me, I love doing startups, and there you go, my 9 startups, startup in about 20 years.
Yes, glutton for punishment.
Yes, exactly. Yes. So I'm a mentor, advisor, entrepreneur, and speaker, and producer of events. So all of the above. So, but yeah, I'm an entrepreneur. I like to do things, and I like to help startups to go to market. There you go.
So obviously there's hundreds of accelerators and incubators, innovation labs these days, maybe not nearly as much in 2015. How do you think the industry has changed?
Well, that's a very good question, Roxy. And actually in 2009, when I met Dr. Eric Topol, I'm going to give you a bit of a background. So we see a bit of a history and evolution of accelerators. In 2009, in April, I met Dr. Eric Topol at a conference around wireless technologies and telecommunications, CTIA in Las Vegas. And that was the very first time when I heard a doctor, talking about, the super convergence of technology. And he was talking about how wireless technologies, wireless sensors, networks like Skype, he was talking about patient networks, even video games for patients. Yeah. So I was looking at him, and it's like, wow, this is amazing. And when I heard the numbers, because you think the telecommunications and wireless industries is the largest industry in the world because it's your industry. Yeah. And when we heard that, the healthcare industry dwarfs really all the other industries in the world, it's kind of an $8.5 trillion industry around the world. United States alone, it's about 3.5 trillion. Canada, it's about 350 billion or so. So when I heard that, I'm like, wow, this is the next thing that we should be doing in Canada. Mm-hmm. But that was 2009. In 2011, we got a grant from the Canadian government, and I started looking at accelerators around the world at the time, in Canada, US, Europe, and Israel. And at the time, we had knowledge of Techstars and Y Combinators of the world. But all these accelerators were focused on web technologies. And so the model was, hey, let's go to market fast. In 3 months, you're done. You go through our accelerator. We get 2% or 6% of your company, or 10%, whatever number. And then you get some knowledge about how to go to market. You put your website up. Eventually, you do a mobile app, and off you go.
Yep.
And so that.
And then you exit.
By like magic. Mm-hmm. So, and then I looked at what's going on in the world, and I started talking with people from healthcare systems and hospitals and physicians, and I realized, like, even here in Vancouver, I visited a hospital at the time, and I remember they were having in the hospital, they were using Netscape as a web browser. This is like a 1996 web browser. And for me, coming from wireless technologies and digital media, it was a trip back in time. Like, I went almost like 20 or 25 years back in time.
Yeah.
And I realized, wait a minute, this industry is one of the last two dinosaurs of the world. One being, education, and the other one, healthcare. These guys have not changed for, I don't know, quite a bit, like 25, 50 years, 100 years maybe. And so it's like, wow, we have a massive problem here, from an acceleration point of view, because, like any dinosaurs, these guys are moving extremely slow. And so how do we move these guys? That I came back and I said, well, listen, creating an accelerator that is actually based on a model that leverages web technologies or even mobile technologies, it's not the right model. Yeah, the right model, it seems to be an accelerator where you spend 12 months, maybe 18 months, maybe 24 months, with companies who understand, how the healthcare system works, understand regulation, understand, efficacy, safety. I mean, there's many, many, many things that we need to understand before you actually can, come up with a company that is sustainable, that has a model that the healthcare industry will adopt. And so that was, 2011. And then we continued for about 4 years with a bit of a traditional model with companies in our cohort. But in 2015, we pivoted and we said, okay, now it's time to actually do a virtual model. And that's kind of how we did it.
So what made you think about virtual, and what made you think about virtual and global? back in 2015? I mean, it seems par for the course right now. But in 2015, I'm sure you had some folks that asked you that question as well. Why virtual? Why global?
Well, it's funny you're asking that question. Like, one of my very good friends is John Nosta, out of New York. He's the #1 digital health influencer in North America and one of the best minds we have in digital health in the world.
Yeah.
And so when I explained to John what we're trying to do, this is early, actually it's late 2014 when we came up with the idea. And John said, well, Michael, you know what? You are actually the first truly virtual digital health technology accelerator in the world. And when you hear that from someone who is obviously in the know, that encouraged me and encouraged us to actually create it. The reason we created the virtual accelerator was simply competition, because if you remember, in kind of from 2012, 13, 14, we started seeing, a huge increase in the number of accelerators, particularly in the United States. Mm-hmm. Yeah. Suddenly, every state had 1, 2, 3, 4, 5, accelerators. And they were either private accelerators, they were university-based accelerators, they were, hospital-based accelerators, they were government-supported accelerators, like in New York and other places. And I'm like, wait a minute. Now, suddenly from 10 accelerators in the United States, within 3 years, we've seen probably 100 to 120. I'm like, okay, this is massive competition. There's no way for us to play that game. So what is the game we want to play? Even in Canada, we had about 10 accelerators at the time. I believe Israel had, just in Tel Aviv, they had, 5 accelerators in one city, right? So when I thought about that, I'm like, okay, how do we play this game? And the way we decided to play the game, we said, well, listen, let's look at sports and let's look at the Olympics. Yeah. So what we want to play, the kind of game we want to play is really, let's, not spend our time and energy in training entrepreneurs, with the basics, with the 101 of how you start a company. There's plenty of accelerators out there, university-based in particular, that's their role, and that's fine. But I thought our role, because we've been in business for a while, is like, let's actually focus on helping accelerators, the startups and entrepreneurs go to the next stage. Yeah. Mm-hmm. So let all these guys focus on, early stage and training. But what we want to do is we want to play with athletes that are kind of Olympics ready. And those are the most talented entrepreneurs in the world. And then we are totally agnostic. We don't care what country are you from. We don't care what kind of technology you use. Yeah. What we do care is if you're a true disruptor. Yeah. And then that's kind of how we envisioned the virtual model. And that's basically why we did it. It was really, we looked at the competition and said, well, we can't compete with, Rock Health, for example, out of, San Francisco and Boston, or we cannot compete with Matters in Chicago. Or Healthbox, who had a bunch of offices. So it's like, it was really a differentiation for us. That's what it was.
So how has it been, kind of describe what it's like to create that global ecosystem where, we have different payment infrastructures and different regulatory and reimbursement guidelines, different payment models. How does that fit into this global ecosystem?
Well, the reality is that healthcare is extremely complicated and complex, as you just described. It doesn't matter the country. Yeah. I mean, in Canada, for example, we have healthcare. It's a provincial matter. We have sort of 13 healthcare systems. Yeah. And on top of that, we have a federal. Right. In the United States, of course, you have all the states who all have very different formulas and ways of dealing with providers and so on and so forth. So very complicated in each country. Germany has a different system. Germany, for example, is one of the most consumer-friendly systems in the world, despite the fact that you think Germans are very kind of stuck and stubborn in a certain way. Yeah. And risk adverse. They go, langsam aber sicher is a saying in German, which means slowly but surely. Yeah. Right. And so So Germany, as a matter of fact, is one of the best countries in the world for digital health. And we see this in the recent changes in Germany. But I think what we offered at Interface Health was exactly this kind of dialogue and understanding of how Canada is different than US, US is different than UK, I don't know, Israel is different than any other country in the world, China is different, Australia is different. So that's kind of, again, a part of our differentiation, because we had entrepreneurs who, wanted to try other systems in the world. Not, generally speaking, Canadians, 9 out of 10 startups are trying to go and sell to the US.
Right.
The largest healthcare system, its proximity, its language, we kind of understand. And we understand it is, obviously profit driven and all that. It's very different from a public healthcare system that we have in Canada.
Sure.
Right. But I think, that was our role, to actually try to understand the differences between and try to guide various entrepreneurs, whether, let's say, you were maybe even from Mexico and wanted to do business in Canada. Well, how do you do that? Or maybe you're a company from Italy or Netherlands. How do you do business in the United States? And our advice was always like, maybe you're not ready for how tough the competition is in the US. Maybe you can deal with us a little bit for a year or two in Canada. We can, get you ready and then throw you into, the massive industry in the United States and the tough competition that exists there.
Well, one of the things that I think is so surprising, and I've spoken to, hundreds and hundreds of innovators over the last few years of, producing this show. And I've been surprised on how many have really been birthed in the US and really struggled with all of the bureaucracy that we've had, prior to COVID in a lot of ways, and had just their arms tied and just really struggled, and ended up having more success in Germany and more success in some of the Asian countries. And so, it's kind of like you're talking about some of these instances where they've been outside of the US coming in. And these are stories where they're like, we can't have success here, but we can outside. And some of them have said that, they had success in Germany and Asia for 2-3 years. And then all of a sudden was able to open the door a little bit more in the US.
No question. Yeah. So, and they were, most likely very smart entrepreneurs, because they figured, hey, we're wasting so much time here. Not wasting is probably not the right word. Yeah. But you're spending an enormous amount of time to try to deal with the status quo and disrupt it, right? And so I'll give you an example, like Babylon Health, which is one of the most successful companies in telehealth and artificial intelligence out of London. Yeah. They came to Vancouver maybe 4 or 5 years ago. And I learned that they actually tried some of their very first technologies in Africa. Yeah. And so in Rwanda, I believe, I'm not 100% sure, but I think it was Rwanda. And so they were very successful there. They learned. And then they tried other markets. Eventually, they came to Canada, and they made a proposition to one of our the largest health IT company, which happens to be also a telco, TELUS Health, and they were successful. Yeah. So there's nothing wrong in trying to be successful in Vietnam or Rwanda or Germany or other places, New Zealand or Australia, and then come back. And that actually, it's a good lesson for US entrepreneurs, Canadian entrepreneurs, anybody. In the end, I mean, we had another company here in Vancouver who had a very interesting solution for skin cancer. Yeah. And we don't have much skin cancer in Canada compared to Australia, for example. Yeah. Yep. Of course, they went to Australia, and that's where they found funding, and that's where they found, the demand for what they actually had. And then they came back to Canada, and now they're trying to implement their solution in Canada. So sometimes it works that way. You just have to be smart to do that. Yeah.
The dogs in the office are barking. The team members are barking. Hold on.
Oh, there you go.
Anything can happen on this show, Michael. Anything can happen.
Well, somebody had a very good question. It's like, it's do we work from home or do we leave at work?
Right.
So I hope it was not my comments about all these countries that, the dogs started barking. It's like, oh, or maybe it was a sign of agreement.
Right. Yeah. Well, I don't have a doggy door here. And so if you don't let them out, they will show you who's boss. And so you don't, I've learned the hard way. You just open the door and let them out.
Okay, there you go. That makes it for authenticity. There you go.
Right, exactly. So, I want to ask, as we're talking about like the current state at the end of 2020, how has the accelerators and incubators kind of evolving during this pandemic? What are some of the silver linings that are happening? That's obviously, that's kind of helping create a maybe more opportunity, or maybe even in some instances, some greater challenges. And then kind of what do we expect next for going into 2021?
Yeah. Okay. So you packed about 3-4 questions there. I'll try to answer them. Yeah.
Peel away.
Yeah. Well, I think, again, I've been in this industry, in this space for at least a decade, and trying to be as global as possible with a view. I think the opportunity is absolutely tremendous. I had another very good friend of mine, Lucien Engelin from the Netherlands, and he, at our conference, we had an annual conference just about 2 weeks ago, and he had this saying. He said basically that digital health was pregnant for the last 9 years or so.
I love that.
And now we're ready to give birth, right? And so
that is the phenomenal analogy.
It is a phenomenal analogy, right? and so COVID has just created that opportunity. Yeah. And it's almost like a cesarean, right? It's like it has to happen, and it did happen. Mm-hmm. And so the opportunity, it's tremendous. I've seen a recent report by Rock Health. Apparently, there's about close to $50 billion that were invested in startups in the United States alone. Yeah. And so, and that's just investment in startups. Obviously, there's lots of investments by the Googles of the world, the Amazons of the world, the Microsofts of the world, the Apples of the world, the Facebook of the world in virtual reality, for example. Mm-hmm. Yeah. So I think the innovation economy, the disruptors are working very hard to change things for the better, to take down in a way the wall that was created by the status quo. The status quo is working still very hard to maintain the status quo, and that's their job. Our job is to go in, disrupt, create new opportunities, new jobs, new wealth. New opportunity for everybody. Mm-hmm. Create better access. Create, reduce the cost. I mean, just in the U.S., probably about $1 trillion just a waste or obscene profits, right? And so, if we can actually solve that problem in the U.S. alone, and that actually goes through many other systems around the world, where that 20-30% is just fat. We can do things way faster, way better, way smarter using digital health. Yep. Now, the digital health technology accelerators have come and gone, right? I've seen already 2 or 3, maybe 4, waves of digital health technology accelerators. We're one of the last ones, so to say, because we figured out a different model. But I think, digital health technology accelerators, like any business, have a limited lifespan. And more so, if you are doing your job, you should probably be in business for 5-7 years and then get out of it. Unless you maintain or figure out a way to be relevant. Mm-hmm. And so I would say let's just say that in the world right now there's 200, maybe 300 accelerators in our space in digital health. Well, the 80-20 rule applies. So 20% of them are probably still doing a very good job, and 20% of the 20% are doing a phenomenal job. Mm-hmm. So those are the I guess what's going on in the market. We've seen a few companies who are gone; they don't exist anymore for all the right reasons. But we also see all these newcomers at whether they're sponsored by pharma or created at university level or by a city or by a state like in New York or other places. And I would say that one of the things that I've noticed is that they're hiring the wrong people to run those accelerators. And that's probably one of the reasons that within 3 years, 5 years, they fail. Yeah. Meaning that, even in London, I've seen an accelerator very large. I'm not going to name it. Yeah. But they were just doing, optimization of an existing healthcare system. Yeah. Which in itself, it's sustainable innovation, is not disruptive innovation.
Right.
Meaning, let's do innovation for our own sake. Yeah. Well, that's not quite what, Clay Christensen defined as disruptive innovation. Mm-hmm. And so I think the true accelerators who have a purpose and who actually are driven to create that change, in a positive way, empower the patients to, be in charge of their own health, which is the democratization of healthcare. Accelerators who understand how to digitize medicine, to make it more effective, to make it, to focus on preventative medicine, precise medicine, and personalized medicine. Those who understand that, they'll figure out the value chain and how to create money, and opportunity. So for me, I'm the eternal entrepreneur, so I'm always optimistic. Yeah, it's like, guys, this is not there. Yeah, I have a bit of a distorted, sense of reality, maybe. But it's like, that's what needs to happen. Like, we will continue to try to do better and change things for the better, for the patients, for the physicians, for nurses, for everybody involved on the healthcare side. And on the consumer side, which is another 4 trillion opportunity. Again, there's lots of opportunities for digital health as well.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So, Michael, you kind of touched on a couple of buzzwords that, some of our listeners and viewers might understand the distinction. Hopefully, a lot of them do. But for those that don't, what is the difference between a disruptive innovation and a sustainable innovation? And why does that even matter in the commercialization process?
Very good question. So I wrote a few articles and I explain this all the time because you have, let's say, a healthcare system. You have the, head of IT or the chief information officer of a large hospital, and usually what they do, because it's an existing large business. Yeah. Let's say they run $100 million, $200 million, $1 billion, or a $2 billion, healthcare system. It's an entity that exists and has certain rules, have a certain business model that doesn't like to be interrupted or changed. Mm-hmm. However, your job when you run that system is to optimize it the best possible way. So I've seen a lot of folks from inside the healthcare system who think they're doing disruptive innovation when in fact it's sustainable innovation. Yeah. Which don't create new jobs. Yeah. They just make things better, but to a certain degree. The definition of disruptive innovation, as in Clay Christensen's definition, is the creation of new jobs, the creation of new business models, the creation of wealth. That's why you have Airbnb. That's why you have, Uber. Those are massive disruptors who go into an industry that, let's say the hotel industry that performed that way for the last, 50 years. And suddenly Airbnb comes in with a model. Well, here's a new way of doing things. So, and they changed the whole global industry. Yeah. So that's what software does. It comes in and it creates that kind of opportunity. So that's the difference between sustainable innovation and disruptive innovation. I would rather go for disruptive innovation And if I am running an accelerator, those are the kind of technologies I'm looking for that will create real change, not, incremental change in, hey, we're better 5% this year. Yeah. Or we created a little bit better profit this year with our hospital. On the contrary, I think if you're a true disruptor, you need to come up with solutions that will truly disrupt the existing models.
So kind of just, following that, one of the things that I think is so interesting is that as you've got those larger institutions, right, that have been in business for a long time and they're doing more of the incremental innovation internally, they are really prone to kind of get caught off guard, like Airbnb or like Uber, with other entities that are disrupting the industry as opposed to disrupting it themselves, because they're thinking about the same customer group that they currently have. And a lot of times they get kind of caught in this loop of meeting those needs as opposed to the, how Clayton would describe it, the bottom of the market that has just completely different needs than, those incumbents. And so we see that happen, quite often with them getting disrupted. And I think what you're describing here, there's a lot of strategic considerations because, like you said, having an incremental or sustainable innovation isn't a bad thing. It's just a completely different business. and knowing the strategies and the tactics that are different for each one, I think becomes really, really important as well.
Well, Christina Farr, who is a reporter for CNBC, she's covering healthcare and technology. I remember maybe a month ago or 2 months ago, she asked one of the folks who are running a hospital in the US, and it's like, how is it going? Like, what's going on? Like, what's happening? It's like, well, we're in deep trouble because we're losing like $2 million. And she's like, a month? It's like, no, a day. Yeah. So that tells you, how the GPs, general practitioners, family doctors around the world, not just in the US, but in Canada and other parts of the world, were absolutely completely caught off guard with COVID. Like we have been talking about telehealth and virtual medicine for at least 2 decades.
Yeah.
And all the systems, for whatever reason, they didn't adopt it. Well, guess what? COVID happened and they had to change almost overnight. Yeah. So it was all an artificial, barrier, because when they had to perform in a certain way and they had to create reimbursement codes almost overnight, where before it took you 3 years to create a reimbursement code, they had to do it. And so now we see this massive behavior change on the consumer side. The consumers know that they can visit their family doctor or specialist, just like you and I right now. Yeah. You don't have to go to the office or the clinic or, whatever enterprise you're running. So I think that is a massive change. And we have seen a massive change in physicians' perception and physicians' use of new technologies. Yeah. I've seen doctors who told me, it's like, Michael, I never believed that this actually can work. Like email cannot work. Right. Doesn't work.
It works in all those other industries, just not healthcare.
No, in our industry doesn't work. Well, guess what? They came back and said, you know what, Michael, it does work.
Yeah.
Exactly. Well, why it took us 10 years to convince you and we couldn't, and now COVID managed to convince you. So there you go. So now that's what I mean, Roxy, by it's a tremendous opportunity for startups and entrepreneurs. Why? Because by the time this COVID will be over, the whole world has spent probably 10, maybe 12, maybe $15 trillion. That's by the end of 2021. Yeah. With all the efforts around the world for whatever reason. And what that means is that the whole world, governments in particular, but also the private sector, has invested all this money to change our behavior. We are all forced, more or less, to stay at home, like work from home. Well, imagine the opportunities for digital health, which is what we wanted to do from the very beginning, which was, to bring solutions to you.
Right.
At home, in your car, wherever you are. That's what we try to do. Well, here we are. We didn't have to pay for that.
Yeah. So I imagine over the course of your career, kind of thinking either, recently or just in the last few years, share a couple of stories with our listeners that, maybe you came across either an innovator or a technology solution where you just kind of looked at it, you looked at the team and you were like, and it just really blew your mind and they ended up being wildly successful, because you hear stories like that all the time.
So I would say that one of the stories that blew my mind was actually our winner in 2015. It's a company called Sproxel out of Boston. Yeah.
Mm-hmm.
And when we looked at them initially, we said, they were just using SMS. Yeah. Short messaging system, right? For mobile phones, not even for smartphones. Yeah. For feature phones.
Yep.
Yeah. This is a company out of Boston who said, well, listen, we want to save people's lives because at the time, people in Africa were accessing, fake drugs that would kill them. I think the numbers were something around 700,000, I believe it was the number. Mm-hmm. And these guys came in and said, well, listen, we're going to use SMS. We're not going to use complicated technologies in Africa, but people use feature phones and they're going to use SMS, and we're going to, help them actually, save lives. And we're going to help the pharma industry by helping them, sell the right drugs to the right people. Mm-hmm. So basically, imagine this, where you go to a pharmacy, in Africa, and then you buy a drug. Well, you can scratch it, yeah? And there's an SMS code. You send that code, using your phone to a database, and that database tells you right away whether that drug is the real one or a fake one.
Yep.
Simple solution. It helps the patient. It helps the physicians. It helps the system. It helps also the brands, the pharma. To me, that was one of the simplest, most beautiful solutions out there, which taught me a lesson that you don't have to have complicated solutions. Think very simple. Think about what you're trying to solve. Again, Clay Christensen said, what's the job that you hire that app to do for you?
Right.
Or that service or that product.
Yep.
And so, I have stories like that. I've seen stories now in virtual reality, for example. We've seen 20, 30 years of research in virtual reality, whether it's Stanford or, McGill in Canada or Simon Fraser or Barcelona. Tremendous applications in PTSD, in mental health, depression, anxiety, in obesity, and all these areas. So now I'm seeing kind of a new generation of, therapies that are using artificial intelligence, virtual reality, augmented reality to, help patients and consumers find solutions. So, I think, the world is super exciting. The technology is growing exponentially. Yeah, we can't keep up, really. The people, I guess, generally speaking, and healthcare systems don't understand how fast things are moving. Yeah. Hopefully this COVID has been a wake-up call for everybody. And so hopefully we can see, a much better world out there in 2021, 2022, that will, result in better experiences, lower cost, smarter healthcare that is, designed to actually help save lives.
Yeah. So Michael, there's, I would say probably hundreds of thousands, maybe if not millions, if we're talking about globally, of these innovators that are in different stages, whether it's, these, big organizations, longstanding, or whether it's startups. There's so much innovation happening. What are some of the key barriers that you think that are going to prevent people from being successful, from successfully commercializing that innovation? And then what are some recommendations that you have?
All right. So I think from the very beginning, you have to understand the game you play. So, and the way I'm looking at the global market is these two massive global markets. One is the consumer health market, which is just health and wellness applications. It's non-regulated. It's relatively easy to get in. Yeah. And so that's one massive market, about $4 trillion. The other one, of course, is healthcare, which is about $8.5 trillion around the world, which, United States about 3.5 trillion out of 8.5. So you can see how massive that industry is. What would my advice always is, first of all, I mean, it's all about the need. Yeah. Try to figure out a real need. Yeah. Don't come up with a technology that has no need. Yeah. It may be cool to know artificial intelligence, machine learning, whatever, virtual reality, all sorts of applications. Try to find a real need. That, to me, that is the essence of entrepreneurship. Try to find a real need. And
that's so basic. Why is that so difficult, right? I mean, that is just like the foundation of every successful company. And we logically, intellectually, we know I have to be able to meet a need in order to have a sustainable business. But like, why are we still talking about that? Why is that so difficult?
Well, because this is my opinion, because I believe that when you hit the healthcare system, maybe you have a good idea on how to solve, I don't know, mental health, anxiety or depression or PTSD. Things get complicated extremely fast. Yeah. And so from having a good idea, and possibly even a concept beyond that idea, things get complicated very fast because the healthcare system doesn't like ideas, doesn't like concepts. Yeah. The healthcare system likes evidence. And if you don't understand how to create that evidence, by using obviously, people inside the healthcare system, like clinicians and researchers, and create that legitimacy, that's where you fail. You think, let's say you're an engineer and you don't quite understand. I have examples like this in the security and privacy business, for example. Folks who have been extremely successful in financial services and other industries, they can't penetrate the healthcare industry and they don't quite understand why. Well, it is because the healthcare industry is very different from any other industry on the planet. Yeah. And if you don't understand that, then you fail. Yeah. Mm-hmm. But it goes back to the need. Then it goes back to the team, like always. To me, every time I see entrepreneurs who come in, it's like, hey, Michael, I have an idea. It's like, how many of you are out there? Well, it's just me. It's like, oh, please go away. Yeah, go away. Like, you can't succeed. Yeah. You need to have a band, like a rock band. Yeah. Mm-hmm. You need 2, 3, 4 co-founders, to work. And particularly in healthcare, you need someone who understands product development. You need someone who understands, sort of a chief medical officer, somebody who understands healthcare, a medic, a physician. You need someone who understands, technologies in healthcare. Yeah. And then you need possibly a designer, who understands design thinking and understands how to create beautiful products and services. So if you don't have that team with you from kind of the very beginning and a good understanding of the industry and the domain you're in, because this healthcare industry is so massive that pretty much every vertical that you have in it, whether it's COPD or diabetes or pulmonary diseases or anxiety or mental health, and even in mental health, again, you divide it. Yeah. All these verticals are massive verticals, anywhere from, $2 billion to $200 billion. Yeah. And so again, understand your vertical that you play in. Yeah. So it's hard, but that's what makes a good entrepreneur. And we have seen, a lot of companies coming from, let's say, Rock Health. Quite a few of them have been successful. We have seen, some of them going IPO these days. Somebody told me, it's like, hey, it's very hard to get into the healthcare system, but once you're in, you're kind of in for life. Yeah. So that is a very good reason for any investor to be patient. Yeah. And to, put money in those startups who actually want to change the world, but do have patience. This is not a fast game. You need 5, 7, sometimes even more than 7 years to actually show results in digital health.
I'm sure all the health innovators listening want you to say that again for all the investors that are on them, that have invested in their companies. They're like, can you say that one more time? Because it's only been a year. It's only been 18 months. Still keep the faith.
Well, yeah, keep the faith. And we have seen now, with COVID-19 or coronavirus, we have seen such an increase of investments in telehealth, in mental health, in digital therapeutics, like we've never seen before. One of the last stats I've seen, I think the investments in telehealth in particular is something like 1,400%, compared to last year. So there's no question that the capital is smart. They understand where the puck is going to be, 3, 4, 5 years from now. So the opportunity is there if you're in the right place. I would say that there's areas in healthcare where it's not a good place to be. I looked at some statistics from Switzerland. I believe somebody did a statistic, and some hospitals and some healthcare systems actually are decreasing their budgets on IT because they don't have the money. Yeah. So be careful where you go. Yeah. So, but the opportunity, nevertheless, is massive. And again, you'll have winners and losers. You'll have people who understand where the puck is going to be 3-5 years from now. And if you're an investor and you're smart about your money, then by all means, that this is a 5 to 7, maybe 9 years long play. It's not something that you see your money back in 12 months.
Yeah. Yep. That's for sure. Long sales cycles, a lot more complicated. So just any last words of advice for anybody that's in the trenches today before we wrap up?
Well, I would say, be kind, be calm, and be safe. This is what our Chief Provincial Officer says here, Dr. Bonnie Henry in British Columbia. It's just stay healthy, stay fit. Try to, we can do a lot of work just like this remotely. And, the technology sector is doing actually pretty well compared to, let's say the hospitality, the airline, the transportation business. Yeah. So think about that, how lucky we are to be in this industry and to be able to actually help. Yeah. And so to me, that is, have that purpose in mind every day. It's very meaningful. And so go for it, go and change the world. And, that's all I can say. And if you think that Interface Health can help you in some way, you know where to find me or where to find
so how can folks get a hold of you if anybody wants to follow up with you after the show?
I'm so easy just LinkedIn is fine. Interfacehealth.com, at Interface Health on social media, Twitter. So if you really want to get in touch with me, you'll find a way to get in touch with me.
All right. Well, thanks, Michael.
They can ask you, Roxy.
Yes, exactly. Just ask me. I'll put you in touch. Thanks, Michael, for joining us today.
Okay, very much. I enjoyed it very much. Stay safe and be healthy. Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.